Hey guys, good evening. Good evening. Tonight we're going to be doing some medical assistant certification prep. I know I haven't got on here in a while and done any with you guys, but we're going to get into that right now. So if you are joining me, do me a favor, let me know in the chat where you are joining me from. Let me know your city and state. Just comment it in the chat. We're going to get right into it. For those of you that don't know me, you guys know. Well, for those of you that don't know me, you may not know that my name is Kendra, aka Miss K. I've been an MA since 2004 and an MA instructor since 2011. And one of the things I do on this channel is I help you guys prepare for certification, and that's what we're going to do tonight. And I'm going to let you guys know, for anybody that's preparing for certification, I have what's called the CCMA refresher course. And this is for anybody that is in school that is preparing for certification. Or maybe you've been out of school for a while and never got certified. This is for you. Or maybe you're somebody that's been working in the field for a while and you just never got certified. You never went to school, but you've been doing MA work. If you're watching a replay, it's already going to be in the chat for you in the comment section for anybody that is watching live. So this is the link for the MA refresher course. It is a study guide. Make sure you get the right one though. If you're studying for a clinical creative test like the CCMA, you want to get the administrative one, okay? Also, my ebook. Some of you guys are like me and you're business minded, even though you're in a medical field. You're like, listen, I want to make some money outside the clinic, beyond the clinic. My ebook, I'll leave that link for you guys as well. Again, if you're watching a replay, that's going to be linked below anyway. But for those of you that are joining me live, let me go ahead and put that in the chat really quickly. Are my people on Facebook? Let me see you guys check in on Facebook. I see you guys on YouTube, but let me know that you guys on Facebook are here as well. I see you know what? My comment for some reason is not posting on Facebook. But do me a favor, somebody in the chat from Facebook, just chime in really quickly for me. And I do want to say, excuse me in advance, I live near a train track, so you may hear the train actually is going past now. So I don't know if you guys will be able to hear it in my background, but just in case, I want to say, excuse me now. Are we live on Facebook? Somebody on Facebook, do me a favor, check in, and then we can go ahead and get started. See everybody on YouTube. Congratulations to everybody that have passed your test. Good luck to everybody that's about to take your test. Tady Craig, I'm glad you made it. I think I saw your comment on Facebook. You said you're about to take yours on the 2nd. So I'm glad you made it too. So if you are new here, for those of you that have never joined me live, how it works, we're going to go through some questions. And I usually wait a few seconds just to make sure you guys put the answer in the chat, and then I go on to the right answer. Now, these first few slides are going to be a little bit different because we're going to do some dosage calculation, and I'm going to actually do the problem on the screen. So I'm going to do a little bit different. Usually I just have some open-ended and multiple choice questions, but we're going to actually do some dosage calculations together. And I do see a comment from Facebook. Okay, perfect. So now we're going to go ahead and get into it now that I know my Facebook people are joined in. So again, guys, if you need some extra study beyond my videos, go to marefreshercourse.com. That link is in the chat. If you're trying to earn some money outside the clinic as a medical assistant or nurse, you can also go to the chat as well, because I did link that as well. Okay, so let's go into this next slide, guys. Let's get into it. Well, the first slide, I should say, not next slide. All right, guys. So provider orders 1,000 milligrams of a medication. The label reads 250 milligrams. How much do you give the patient? Now, this is an example of what you might see on a test. They're going to give it to you just like that. They may say the actual name of the medication, or they may just say the provider wants you to give 1,000 milligrams of a medication to the patient. You go to the medicine cabinet, What you have available is 250 milligrams. How much do you give to the patient? I'm going to see if you guys put that answer in there. And don't worry, if you are still in school, you're still, learning this, that's perfectly fine. If you're somebody that struggle with dosage calculations, that is perfectly fine. That's why I'm here. If you happen to get the answer wrong as we're going through this, that is fine as well. That's why we're doing this, okay? So what I'm going to do something a little bit different. I'm going to work this out right on the screen for you guys. So this next slide here is blank. So what I'm going to do really quickly, I'm just going to work it out right in front of you. So let me go to choose and let me go to draw because I'm going to work it out right here. So it says 1,000 milligrams, right? So guys, what I want you to do, I want you to remember the equation D over H, right? So D is desired dose. H is what you have on hand, right? So you want to divide what the doctor wants by what you have on hand. So desired was what? 1,000 milligrams. And that's what the doctor wants. So you got 1,000 milligrams. Okay. And mind you, I'm doing this with my finger, so it may be a little bit sloppy, which is fine. And then how much did we say we had when we went to the cabinet? What did I say we had? Did I say 250? I think I said 250. Let me go back. Yeah, 250 milligrams. Okay. So we're going to do 250. And just a quick trick for you guys. If you may see big numbers and you may get intimidated, all you need to do is just cancel out the zeros. Okay. That's all you're doing. You're just going to go here. So that way, instead of dividing 1,000 by 250, you're dividing 100 by 25, which gives you how much? What is 100 divided by 25? All right, somebody already put it in there, and that's going to be 4. So in this case, you would give the patient 4 tablets. All right, now this is where we start. Again, D over H, just remember that formula, okay? What the doctor wants by what you have on hand, okay? All right, y'all got that? Let me look in the chat. Make sure you guys got it. Let me just look in the chat. Make sure you got it. All right, I see that. All right, so let's go to the next one, okay? And let me just make this bigger really quickly just so I can make sure you guys can see that. So D over H. And when you know the formula, when you guys go take your test, all you're doing is plugging in whatever number they give you, okay? You're just plugging in whatever number they give you. Okay, let's go on to the next one. So another example of a dosage calculation question you may see, the provider orders 750 milligrams of a medication. When you go to the cabinet, it's available in a liquid, and the label is going to say 250 milligrams per 5 milliliters. How much did you give to the patient? Okay, so in this case, the medication that the provider wants, the strength that he wants, what a dose that he wants is 750 milligrams, right? And you go to the cabinet and it's a liquid, and the label reads 250 milligrams per 5 milliliters. What this means is that for every 5 milliliters of that liquid, there are 250 milligrams of the medication. Now, what do? I'm going to go ahead back like I did before, and I'm going to work it out on the screen for you guys. So let's go back to it. So he wanted 750 milligrams. So in this case, we're going to have the D over H. But this time, because you see that 5 milliliters is a liquid, we're going to add the Q, okay? So when you guys see that milliliters, you know it's a liquid, we're going to add the Q, okay? So he wanted 750 milligrams, right? When you went to the cabinet, it said 250 milligrams per 5 milliliters. So all we do here, same thing. We're going to divide what the doctor wants by what we have on hand. We're going to cancel out that 0. So instead of dividing 750 by 250, we're dividing 75 by 25, which is what? How much is that? Okay, I see y'all are already on it. So that's going to give us 3. So 750 divided by 250, or 75 divided by 25, that's going to give us what? 3. Now, the only other difference now, the next step is that we're going to multiply by the Q, and the Q is simply the 5 ml. So that's going to be 3 times 5 ml which is going to be what? And I see you guys already put it in the chat. Y'all are already on it. 15 ml. Let me make that big so I can make sure y'all can see that. Can you guys see that? Sorry it's sloppy, y'all, but I'm writing with my finger. This was the best way to make it work. So D over H times Q when it's a liquid. So we divided 750 by 250, and then we multiply by the quantity, which is 5 ml. Okay. Yes, you are correct. Somebody said, would that be 5? Yes. Somebody said, I definitely struggle. I get it. I'm not a math person at all, so I understand what it's like to struggle with math. All right, so another example of a dosage calculation medication you're going to see. So let me just say this. Let me go back, first of all, to this right here. Everything we do is always going to bring us back to this here, and it's always going to bring us back to this, okay? So as long as you know, always start with the basics. As long as you know D over H, what the doctor wants, divided by what you have on hand, that's your foundation, okay? Then that was the solids. When you get into the liquids, that's when we do the times Q, right? That's the 5 milliliters. Now, when you go to pediatrics, it's a couple extra steps, okay? Now let's go through an example you might see. You'll see a problem that looks something like this. The provider orders 40 milligrams per kilograms a day of a medication for a pediatric patient. When you go to the medicine cabinet, the label reads 200 milligrams per 5 milliliters, and the patient weighs 10 kilograms. How much are you giving a patient? Now, I will give you guys a heads up. I just went on ahead and said, I just went on ahead and made the problem into kilograms. When you guys are taking your test, it may read in pounds. If it reads in pounds, the first thing you do is you convert that pounds to kilograms. Somebody do me a favor and just remind us in the chat, how do you convert pounds to kilograms? Okay, now let's just say the problem said the patient weighs 22 pounds. In that case, you would have done what to get to kilograms? Because that's always going to be the first step. If the problem is already in kilograms, you're good. But if it's in pounds, you got to convert it to kilograms first. Does anybody know how to do that? Does anybody? Exactly. You divide by 2.2. Okay. And so when you're going from pounds to kilograms, actually, you're going to say 2.2 times, let me see, I always get it mixed up. I have it. Let me see, 2.2. You're going to go 22 pounds divided by 2.2, and that's going to give you 10 exactly. The other way around would have been multiplication. Sorry for misspeaking. So anytime you're going from pounds to kilograms, you're going to divide by 2.2. All right. Anyway, all right. So the first thing you do, you got your kilograms. Now let's look at this. The provider wants 40 milligrams per kilograms. What that means is that for every kilogram that patient weighs, the doctor wants 40 milligrams of the medication. So that's automatically letting you know that we're going to have to multiply, because the patient weighs 10 kilograms. And for each of those kilograms, the doctor wants 40 milligrams. So I'm going to minimize this again and go to this next screen so we can do it again. So 10 times, we're going to start with 10 times 40, which is what? What is 10 times 40? 10 times 40 is going to give us what? 400. So in other words, the doctor wants 400 milligrams, okay? Because he said for every kilogram, he wants 40 milligrams. So now we know what the doctor wants. The doctor wants 400 milligrams of the medication. So this is the dose, okay? So this is the desired dose. This is going to be our D, okay? And the medication label, let me go back one more time. The medication label reads 200 milligrams. Again, y'all, sorry that it's, I'm writing with my finger, so it's going to be a little sloppy. Sorry about that. All right. It takes us right back to what we just did a minute ago. We're going to divide what the doctor wants by what we have on hand, okay? Oops. Sorry, y'all. Let me go back a little bit. Let me fix that really quickly, because I done exit out the wrong thing. Okay, let's do that again. All right, so 40 divided by 20 is how much? Let me look in the chat and make sure you guys are with me. Okay, so y'all are already on it. All right, so we got 400 divided by 200 is how much? Somebody let me know how much that is. 40 divided by 20 or 400 divided by, yep, somebody said 2. So that's simply going to take us right back to 2 times 5 ml, which is what? 10 ml. So this is how much the baby is going to get. 10 ml. Okay, so this is one example you might see. So again, when you have problems like this, the very first step we would have done is to convert the pounds to kilograms. In this case, the kilograms was already a part of the problem. Okay, so I already included that, so we didn't have to do that. The next thing we did was we had to figure out what the dose was. For every kilogram that patient weighs, the doctor wanted 40 milligrams. So we multiplied 10 times 40. Once we got the 400, that's how we know how much the doctor wants. He wants 400 milligrams a day. We then divided that by 200 milligrams, and then we multiplied that by the 5 ml. Just again, always remember your formula, D over H. When it's solids, when you're doing liquid, it's D over H times Q, which is your 5 ml. Okay, are y'all with me? Hopefully y'all are with me. All right, so let's go to the next one. And this is one more example of a dosage calculation problem you may see. It's just like the last one, but it's just one more step. Okay, so same thing. The patient weighs 10 kilograms. We already got that. We don't have to convert. The provider wants 40 milligrams per kilogram, but this time he wants it BID. What's BID? Twice a day. The label reads 200 milligrams per 5 milliliters. How much do we give the patient? So we're going to do this again one more time. I just wanted to give you guys just some examples that you may see. So again, for every kilogram that patient weighs, the doctor wants 40 milligrams. So we're going to say 10 times 40. Same problem. It gave us 400 milligrams, right? We went to the cabinet and the label read 200 milligrams per 5 ml. Okay. That gave us what? 2 times 5 ml, which was 10. Now, the only difference is that now he wants it BID. So what are we going to do in this case? In this case, we're simply giving that baby 10 ml of that medication twice a day for a total dose of 20 milliliters per day. And listen, y'all are already on it. Y'all don't need this. Y'all are already on it. So hopefully anybody that struggles with dosage calculations, hopefully this was helpful. Once you know your formula, all it's about is just, putting in whatever numbers they give you, but the formula does not change, okay? The formula does not change. So I just wanted to go through a few of those. All right. Let me know how y'all feeling in the chat. Now let's get into some other questions, some other possible questions you may see. And again, focus on the content, not the question itself. When a drug no longer produces a desired effect, what is it called? Is it a contraindication, an intolerance, a precaution, or adverse reaction? If a drug no longer produces a desired effect, is that called a contraindication, an intolerance, precaution, or adverse reaction? All right, I see your answers coming in. And if you said B, you are correct, okay? So a contraindication would be like a reason why the patient can't take that medication. So like maybe, the patient is pregnant. They can't take a certain medication when they're pregnant, or maybe they can't take a medication because of, some other illness that they may have. Because if they take this medication, it's going to enhance their, it's going to cause their blood pressure to go up. A precaution is more so, think of what a precaution is. Like you can't take a certain medication with milk, or you can't take it on an empty stomach, or you need to take it with milk, right? Or with water. Adverse reaction, a lot of people get that mixed up with side effects. Side effect is more so like, you may take a medication, it's going to cause you to itch or have a headache. An adverse reaction is usually something more serious. That means that as a result of taking this medication, you may end up with kidney issues, right? So that's the difference between adverse reaction and side effects. What happens? What is it called when a drug lessens or increases the effects of increases or lessens the effects of another drug? Is it a precaution, intolerance, interaction, or an adverse reaction? And I pretty much just explained them all in the last question. And if this is your first time joining us, make sure you are taking notes. If you're watching a replay, make sure you pause it. Anything that you didn't know, you should be adding that to your notes. So if this is your first time seeing any of this, all of this should be added to your notes. Okay. So if you say interaction, yes, that is true. So a drug interaction happens if one drug lessens the effects of another, or it increases the effects of another drug. This is why some medications cannot be taken together. And this is why, as a medical assistant, when you guys are bringing your patients back, you have to make sure you're getting an accurate medication list every single time, because if a patient is on a certain medication and not supposed to take something else, the doctor needs to know what they're on. Okay, so that way that mistake doesn't happen. I've been a part of a malpractice case where this happened, where the patient medication list was not accurately reconciled, and then it ended up in a fatality. So this is why it's so important to make sure you do that medication reconciliation, even if the patient was just there. Okay. All right. What type of medication is an antiemetic? I'll give you guys a minute to put that in the chat. Now, y'all probably noticed by now, I am stuffy. I am dealing with the cold. Y'all might say, why you sound like that? I am really stuffy. So we want to get through the rest of this really quickly. We don't have a lot tonight, just a few. What is an antiemetic? If you said it treats nausea, you are correct. Make sure you guys know your medication classifications. How does a vasodilator work? What is a vasodilator? So again, medication classifications: antiemetic, antitussives, anticoagulants. Make sure you guys know these medication classifications. So vasodilators, they lower blood pressure. Okay, so they dilate blood vessels. They allow for improved blood flow, and it lowers blood pressure. Now, the opposite of that, a vasoconstrictor. So if a vasodilator lowers blood pressure, it improves blood flow, it dilates the blood vessels to lower blood vessels. What do you think a vasoconstrictor does? It does the opposite. It narrows blood vessels, okay, to raise blood pressure in a case where a patient has hypotension, okay? How many leads are on a standard EKG? How many leads are on a standard EKG? Now notice I didn't say how many wires, how many leads. So there are 12 leads. So remember, it's a 12 lead EKG. Now this, the way they may ask you about this on a test, they may ask you straight out, how many leads? You got to make sure you know it's 12. Now the difference between the leads and the wires, although we only put 10 wires or 10 electrodes, it's okay. I see somebody say, oh, LOL. It's okay. A lot of people say 10 because they're thinking about the wires and electrodes that we put on the patient. So the 12 lead EKG refers to the fact that the EKG is reading from 12 different directions, okay? 12 different areas of the heart. That's where the 12 leads come from. And you got to make sure you know where each of them are reading from. And we're going to talk about that in just a second after we talk about this question right here. Which of the following is not a bipolar lead? Now, in a bipolar lead, that refers to a lead that is coming from two different directions. Okay. 12 leads mean it's coming from 12 different directions. Okay. After we answer this question, I'll go into a little bit more. Okay. So I see the answers are coming in. And if you said AVL, yeah, you're correct. Okay. So let's talk about this for one quick second. So lead 1, 2, and 3. Those are called bipolar leads. That means that they're coming from two different directions. Okay. Lead 1 is coming from your right arm and your left arm. Lead 2 comes from your right arm and your left leg. Lead 3 comes from your left arm and your left leg. Okay. They're coming from why do I keep saying 3 different directions? They come from 2 different directions. Now, everything else, your AVL, which is your left leg, your AVR, which is your right arm, and then your oh my goodness, what is why I can't think of the other one? The freaking AVF, AVL, and AVR, and then your V1 through V6, those are all unipolar leads, meaning they're coming from one direction. Okay. So just remember, lead 1, 2, and 3 are your bipolar leads. Every other lead is coming from one direction. Okay. Meaning just one area of your heart. Which principle of ethics refers to doing no harm? Actually, I thought I had I think it's another EKG question coming up too. Which principle of ethics refers to doing no harm? Yes, 12 views. Yep, 12 views, 12 different directions. So just remember that 12 different areas of the heart. 1, 2, and 3 are coming from 2 directions. Everywhere else is coming from 1. So when you see that as a question, as long as you know 1, 2, and 3 are the only bipolar leads, then you know everything else are unipolar, meaning they're coming from one direction. So doing no harm, that's non-maleficence. Okay, here's the other EKG question. I should have had this one right after the other one. But what color is the wire on the right arm? So this is another thing you guys have to know are the colors. You do have to know the colors. You know, you might be asked about that. So once we answer this, I'll tell you guys the colors for each one. So which one is the right arm? Is it white, black, red, or green? And it's okay if you don't know. Just take a guess. It's all right. Just take a guess. Oh, I see y'all already putting your answers, and y'all are on it tonight. Okay. Yep. So if you said white, you are correct. So you got white is your right arm. Your left arm is black. So black is going to be your left arm. Red is your left leg. Green is your right leg. Okay. Now when it comes to V1 through V6, those can all be brown, or V1 will be red, V2 will be yellow, V3 green, V4 blue, V5 orange, or V6 purple. Okay. Or again, like I said, they can all also be brown. What part of the soap note would you find lab orders? In what part of the soap note would you find lab orders? Alexa says, wow, this is such confirmation. I was just studying EKGs yesterday. Yeah, make sure you know those EKGs. Yeah, I'm glad you mentioned that. I'm glad you caught me live as well. You know what? Somebody says, why are they colored? I don't want to answer that incorrectly. So I'm going to look into that, why they are colored, if the colors mean something. And I will say this, some colors may be different depending on what you're doing. So the EKG colors are different from like the Holter monitor colors. So I will say that as well, guys. The Holter monitor colors will be different. All right. If you said plan, you are correct. So soap notes. Subjective is what the patient tells you, okay? That's where their symptoms go. Objective is what the patient is what you can measure or what you can see, okay? So like vital signs, anything on the patient you can see, or signs, okay? And then assessment is the doctor's diagnosis or what he think is going on, what he or she thinks is going on, and then the plan is what they plan to do. So lab orders, prescriptions, and things like that. See the patient back in 2 weeks, that's the plan. In which quadrant is the spleen located? In which quadrant is the spleen located? All right. If you said, yep, I see somebody said LUQ. Yep, left upper quadrant. Make sure you guys know those abdominal organs and which quadrant they are in. Yep. All right. What is OS? What is the abbreviation for OS? I mean, what does the abbreviation OS mean? What does that refer to? OS. What is OS? OS is left eye. Okay, so make sure you know that OS is left eye. OD is right eye. OU is going to be both eyes. Okay. Assuming a patient will be difficult due to their cultural beliefs is an example of what? If you automatically assume that a patient is going to be difficult just because of their cultural beliefs, what is that an example of? What is that an example of? So this is going to be stereotyping. Now, somebody said bias. Now that is also true as well. So having your own bias, like being biased, means you already feel a certain way. So that's true too. And I will tell you guys, you won't have to choose between the two because they are used interchangeably, but you won't have to choose between the two. So don't worry, don't get worried if you said, "Oh my goodness, what if stereotyping and bias is an answer?" No, don't worry about that. But this is going to be stereotyping. So you're automatically saying, "Oh, they're going to be difficult just because, they're a part of a certain culture, or, they're a certain age, or they're a certain ethnicity or a certain race." That's stereotyping or having a bias. Yep. So if you say bias, you're not wrong. Diaphoresis. What is diaphoresis? What is diaphoresis? And guys, I see your comments. I'll address some of them once we're done this. I just want to kind of get through this, and then if you guys have any questions afterwards, you can always, let me know. So this is going to be excessive sweating. Excessive, or you may see profuse sweating. So profuse sweating, excessive sweating is diaphoresis. What's CVA, guys? CVA. What is that? CVA. CVA. If you said cerebrovascular accident, aka stroke, you are correct. CVA. Yep. What about TIA? What is TIA? A lot of times, some questions you may see asked, they may just refer to it just as the medical term or the abbreviation, and you got to know what they're talking about. TIA. If you said transient ischemic attack, aka mini stroke, yep, you are correct. What form allows the provider to be reimbursed? Explanation of benefits, assignment of benefits, coordination of benefits, or informed consent? This allows the provider to be reimbursed. Which form is that? A, B, C, or D? Okay, I see the answers rolling in. That is assignment of benefit. So this is what the patient signs that allows the provider to bill the insurance. The assignment of benefits form, the patient assigns it, well, the patient signs it to assign their benefits to the provider. Explanation of benefits, it comes to you in the mail. Well, it comes to the patient in the mail, explaining the benefits, what was paid, what was denied, how much of the deductible went toward the visit. Coordination of benefits refers to the billing process of coordinating which insurance is going to be billed first. So which one is primary? That's what is going to be billed first. And then whatever is not covered, then they'll bill the secondary. Or if they have a third insurance and they have something left over, they may have to bill the third insurance. Okay, that's coordinating the benefits. And then informed consent is a consent that is when the patient is acknowledging the risk and benefits of a procedure. They're signing that they understand that their alternatives, their risks and benefits, it's been explained to them. That is informed consent. What out-of-pocket expense keeps an insurance policy active? Is it co-insurance, co-pay, deductible, or premium? What out-of-pocket expense, they're all out-of-pocket expenses, which one keeps an insurance policy active? Yes, this is going to be on my page after the live. Yes. So for everybody watching on Facebook, Facebook only keeps lives up for 30 days and they delete it. But on YouTube, it does stay up. So I see somebody saying is ruling out answers. So let's get into this answer. So because somebody is ruling out the right answer. So premium. So premium is what we pay to keep insurance active. So think about even like your car insurance. So that's what we pay to keep it active. Okay. That's what we pay to keep it active. Deductible is the out-of-pocket expense that we pay before they will pay. So let's say you have a $500 deductible. That's how much you have to pay as a patient before the insurance policy begins to pay out. Think about car insurance. Let's say you got in an accident and you needed to, get your car fixed. Before they will pay for it, you have to pay that whatever that deductible is. It's the same thing with health insurance. Copay is a fixed amount that the patient pays at every single visit. Co-insurance is a percentage that a patient pays after the deductible has been met. So let's say the patient has a $500 deductible. Once they pay that out of pocket, once they meet that deductible, then they're responsible for co-insurance. And that percentage could be 80-20, meaning the patient is responsible for 20% and the insurance will pay the other 80%. Okay, so co-insurance is a percentage paid after the deductible has been met. Copay is a set amount at every visit. Deductible is what needs to be paid out of pocket before the insurance will begin to pay. And then the premium is what we pay to keep the policy itself. If we don't pay the premium, they will cancel our policy. What's the medical term for ear pain? Medical term for ear pain. Medical term for ear pain. Now, guys, notice some of these are open-ended and some are multiple choice. The open-ended is really what really tests you, because then if you can answer open-ended questions, then you know the information. Now, ear pain could be otalgia or otodynia. Okay. When searching for an ICD-10 code, in what part of the manual should you look first? So when you're doing ICD-10 coding, what part of the manual are you going to go to first? Where should you start? Where should you start? Let's see. You want to start in the alphabetic index. So you always start in the alphabetic index. You find your code. Then you're going to go to the first part, the volume 2, and then um, you're going to double check it. So like for an example, let's say you're doing ICD-10 coding and you are looking for hyperlipidemia and you see that it says E78.2 and then you want to cross-reference it. So you go to the beginning of the ICD manual, the tabular list, and then you look for E78.2 and make sure that it says hyperlipidemia. So you start alphabetic index and then you cross-reference in the tabular list. What is capitation? Yep, you guys are right. Alphabetic, yep. What's capitation? And do me a favor, guys, if you are enjoying this, do me a favor and like the video. I see some of you guys on YouTube are reacting within the chat, which is great, but also exit the chat and also like the video as well. Thank you guys. Also on Facebook as well. And share the video if you guys find this helpful. Share it with somebody else that you know, your classmates and all of that. Somebody says cut off. Oh, I thought you meant the video was cutting off. Maybe that's your answer. So yeah, guys, do me a favor and like the video if you enjoyed it. So capitation, this is a payment system in which providers are paid a predetermined fixed amount per enrolled patient. So instead of being paid for their services, the provider is paid a set amount based on how many patients are enrolled with that. And this is with HMOs. And so the provider is paid per enrolled patient. It's not how much, not based on the services, but based on how many patients are enrolled. Okay. All right, guys. So this is going to be it for tonight. I'll try to come back this week or next week and do some, like the video, share it. And don't forget marefreshercourse.com for those of you who need a study guide. I'll leave that again in the chat. I'll also leave my ebook in the chat again as well. Quickly, let me know if you guys have a question. I'll try to address some really quickly before I get off here. Okay, so you guys said it is helpful. Good to know. I'm glad. And for those of you that said this is your first time catching me live, welcome. I'm glad you were able to make it. I know some of y'all said y'all can never catch me live, and you finally did. So I'm glad you guys were able to catch me as well. Oh, thank you. Athena says your refresher course is amazing. Thank you. Let me highlight that comment on the screen there. Oh, actually, I didn't mean not this one. I meant to highlight Athena's. She said your virtual course is amazing. I'm glad you think so. Pauline said this is the first time. So guys, thank you for hanging in there. I'm glad y'all was able to join. If you're watching the replay, I hope this was helpful to you as well. Good luck to everybody that's about to take their test. Brianna says, is this for CCMA? This is for all of the certifications. Every test asks the same type of question. So if you're taking a CCMA to RMA, yes, this is for all of it. They ask the same type of questions. I promise you. When I was doing my when I was creating my refresher course, I used all of the test plans. And yes, somebody said, is this part of the refresher? Yes. So these are the type of things that I go over in the refresher as well. Somebody else says your refresher has helped me so much. Yay! Super affordable. Yes, it's $27. So anybody that's wondering, it's $27. Yes. You're welcome, Mrs. Create. Brianna says, I'll take mine April 1st. Okay. Tanya says, thank you for taking time to help us. You are so welcome. You are so welcome. Shania, $27. Yep. It's 3 months access, $80 for 6 months access. You can do afterpay if you need to. So you can split it up if you need to. It also, I've had people gift it to someone as well. So if you've taken your test already and you're like, listen, let me go ahead and give somebody else, that's fine as well. All right, guys. So I'm going to let y'all go. I'm going to try to come on here again. For those of you that need tips, just go to my playlist. It says study tips. Go there. I'm going to go ahead and get off here, guys. I am so stuffy. I got right off work, ran to the grocery store, and then I came in here and did this live. So I'm going to go ahead and get off here so I can finish fixing my dinner. Oh, Mina said I just got on. It's okay, Mina. Just watch it. Just watch the replay. Just watch the replay. I'm going to end this and then you'll be able to watch it. Okay, guys, y'all have a good evening. See y'all, if not this week, next week.